Launched in 1965 to bring comprehensive primary care to the medically underserved in rural and remote areas, federally qualified community health centers have grown steadily over the years, due largely in part to their effectiveness in creating greater access to healthcare and improving wellness on a community-wide basis. Today, CHCs have grown into a network that includes over 1,400 centers across America, offering a wide range of cross-disciplinary care and services, from basic preventative medical and dental care to the advanced treatment of serious physical and mental health conditions.
The biggest difference between community health centers and other types of healthcare providers in the community is that we really are a one-stop shop. Patients can come here and get all of the care that they need and walk out the door with medications and therapy and prepared to be able to go back and live their lives. It's far less interruption to their daily lives. That is the biggest difference between community health centers and other similar providers in communities, is that it empowers patients to be able to access their care all in one place. Our providers are supported by a full team of people that make sure that patients, even if they don't have the type of resources that are necessary to provide for their own health, are supported in that work in order to be able to be well educated about the type of care that they receive, about the type of care that they need to provide themselves in their homes and their communities. We address the social determinants of health, something that makes it impossible for people to be truly well if they don't have access to things like quality food, transportation, medication delivery. We address those by supporting patients through the deployment of community health workers who work with them to get enrolled in insurance programs and ensure that they have access to the care that they need as a part of their clinical team.
Here at Desert Senita, everybody is here for healing of all kinds. And because of that, you don't have to worry about what your diagnosis is, whether it be diabetes or a substance use disorder. Here at Desert Senita, we treat you with the same respect, humanity, and dignity, regardless of what your diagnosis is.
From someone who lives here in these rural areas, I notice how Desert Senita changed millions of lives. Now we can have access to the medical services, everything in the same place. I remember when I came to this little town, I had to drive an hour and 30 minutes, 2 hours to have access to health services. And now in Desert Senita, we have everything in place. When you are done with the doctor, everything's ready to go. And now, other thing that we can offer to our community is we have the dental services. We have everything in-house. We love to serve others, and it's a good place to be. Now we offer childcare, totally free childcare for our employees. We're trying to improve everything to get our employees a good benefit, a good services, because we care about them.
I was misdiagnosed by my local medical community. I made a phone call to Desert Senita. I had met them, and within 2 hours, I had response from Desert Senita. The key that I want to really point out, my initial contact with the physicians, one of the doctors said to me, "Linda, just say, I'm giving this to you." I said, "I'm giving this to you." And her response was, "Now you've given it to us. Let me worry. You don't need to worry anymore." I know I've got a handful of friends that are driving 3 hours to one of Desert Senita's clinics because they know they've talked to somebody, they're on board. They are willing to make that trip because they know the kind of care they're going to get.
Community health centers are empowering. They provide opportunities for people to obtain care in their communities, removing barriers that would otherwise prevent them from being able to get that care locally and affordably. The purpose of community health centers is to ensure that people have access to care where they are at. Care that is exceptional, care that is high quality, and care that is driven by patient input. The best part of my job is making sure that patients walk out of these doors believing that their clinic cares about them, believing that our focus is on making their lives better, improving the outcomes for them.
Everyone should have access to affordable health care and caring providers, no matter where they live. Learn more today about the Desert Senita Community Health Center. Quality, local, affordable health care for all. For information on our services and locations or to schedule an appointment, visit desertsenita.org or call 833-444-5040.